I'll give it another maybe minute. I see the number of the participants climbing, so we'll let everyone join and then we'll get started. Okay, it looks like it's calmed down. Maybe a few more people will join as we get started, but good morning, everyone. Welcome to our March webinar series. Today, we'll be talking about care in the long term. Lindsay, can you go to the next slide? I'm sure most of you are familiar with these little Zoom features and housekeeping, but we'll go over them really quickly. Right now we're in webinar mode, so you're automatically muted and you can't see other participants and we can't see you, but of course you can see your speakers and your hosts. As we go through the presentation today, please ask your questions via the chat box and we'll get to them at the end of the session. It's being recorded, so it will be available after today, and you'll see it's posted on centralanaaging.org, that link right there. And again, you'll have access to that after the session today. Our two speakers today are actually Centralana staff. We have Hillary Kaler and Lindsay Tice. Hillary is a long-term care ombudsman for Mecklenburg County nursing homes. She has been with the Area Agency on Aging for the past 20 years. And worked in several counties within our 9-county region. She is actively involved in many coalitions locally and the state, including the North Carolina Culture Change Coalition and the Charlotte-Mecklenburg Aging Coalition. She is currently the co-chair for the North Carolina Ombudsman Association, and she has served on the leadership board for Consumer Voice in Washington, D.C. Previously, she had worked mainly as a social worker in long-term care facilities throughout the spectrum of independent living, assisted living, and nursing homes. And our other speaker today is Lindsay Tice. Lindsay is a regional ombudsman for Mecklenburg County adult care homes, family care homes, and all long-term care facilities in Stanley County. Through her role as an ombudsman, she serves as a residents' right advocate and helps residents and their families work through grievances at their long-term care facility. She has served in this position since February of 2014 and has worked in various roles in long-term care and home care for over 17 years. She's also a part-time professor of psychology at Queen's University of Charlotte. Lindsay has a Bachelor's of Arts degree in psychology from Queen's and a Master's of Arts degree in gerontology from the University of North Carolina at Charlotte. She has been a Charlotte resident since 2001 and hails from the great state of West Virginia. So I will turn it over to them and we'll get started.
That sounds great. Thank you, Kristen. Good morning, everybody. So we're excited to be with you today. And as you can tell, Lindsay and I share Mecklenburg County Ombudsman responsibilities. And we're going to kind of go through this and tag teams. So you'll have a little bit of me presenting in the beginning, and we will go back and forth a little bit. We do enjoy questions, so we'll try to save time till the end. We do have a lot to cover, so we will try to go through and just hit the high points. And like I said, we really do enjoy the questions. So we'll kind of give you that overview, talk a little bit about what an ombudsman is and does and how that works, and then get through that long-term care system. So we will get started. All right, so of course the Ombudsman program is part of the Area Agency on Aging, and you guys are probably most familiar with the fact that we do fund and monitor and support that network of long-term care services in our 9-county service region. Like I said, I actually cover Mecklenburg County. I have covered other counties over the past 20 years. Lindsay currently covers Mecklenburg County Assisted Living and Stanley County. So we touch a little bit of that urban and that rural type of environment. And we do try to upload a lot of good resources and information on our website. So we always encourage you to go to the website if you want to learn more and just kind of pull up some of the things that we may have on there as far as resources when it comes to what ombudsmen do and that overview that we're going to kind of share with you. Okay, so this presentation, of course, goes for care in the long term. So we're going to talk about a little bit of community resources, a little bit of housing options, and kind of go through that spectrum. So we love this slide. Every day, 10,000 people turn 65. Of course, that happened several years ago when we hit that first wave of the baby boomers. And why that's important is that that's how many people are actually needing and requesting services. So trying to determine what you might need and what those services will be is so important in your everyday choices, and things can change. You can live a very healthy life and have the choices that affect you at the very, very end of your life. And sometimes people have different chronic diseases, acute diseases, things that come up, and you might need to make choices a little bit sooner. So it's important to be prepared for sure. So what is an ombudsman? I'm sure all of you have heard of ombudsman before. It's a very strange word. It actually is a Swedish word for advocate. So we actually are put in place to promote and protect the rights of residents in long-term care facilities. So we will go through the types of facilities that we actually go into, monitor, visit, and try to handle complaint resolution within. There are only 3 specific types of facilities that we go into, and we do get that question a lot. What about the housing for people over 50? What about those other options out there? We can act as a resource, but that is not something that is in our purview. And we're actually considered a healthcare oversight agency. So we have that ability to go in and visit residents in these locations, visit because a family asked us to, or a resident called us, or a concerned citizen, a church member. And we do try to be mediative. That is our general piece of work that we do, is to try to represent that resident. And of course, here's the counties that we serve, are all the ones that Centralina serves. And we're probably the second largest area in the state. So there's probably 36, 37 ombudsmen across North Carolina, all housed within the Area Agency on Aging. And that number has changed over the years, but so has the number of facilities, and it keeps going up. That number has changed over my 20 years of being there. I think when I started, it was right around 22 ombudsmen across the state. So you can see how drastically things have changed. So the discussion today talks about a little bit about what we do as ombudsmen in that care system. So a lot of times people will call us, and we get calls about, what do I do? I'm in the hospital. I need to choose a location for my loved one to go to. So we talk to people before, or people who might be planning. Mom's moving down from Michigan. She's coming to live near us. What can I offer her in this community? What's available in the community? So we can touch upon that, which also touches upon some of the services that the Area Agency on Aging touches in the community. Or do I need to have mom be in a facility? Do we need to look at a retirement home? Do we need to look at an assisted living, or when would I need a nursing home? So that's that before piece. During that stay in the facility, we're there to try to advocate and help and educate when there's questions. Something might just not sound right to you. You want an outside opinion. You want to make sure the facility is telling you accurate information, so we can answer those questions while you're in the facility, and try to advocate if we need to, if there's a concern. And then upon that discharge, when people are preparing to go home, once people leave a facility setting, we do not have jurisdiction anymore, but we can offer insight and, again, resources. When you go back, do you have this to be successful? When you go back home, do you need to know these numbers? Are you working with a home health agency? What else is available out there? Do you need an adult day program? What's going on? So we can have some of those conversations to make a good plan and put something in place. So this is just kind of a structure of how it looks within the state. So we do have a state long-term care ombudsman. His name is Victor Oreja. He's up in Raleigh, of course, with his team. There's about 3 folks at the state office. And of course, the ombudsman program is under the Division of Aging and Adult Services. And like I mentioned, there are regional long-term care ombudsmen across the state within those 16 regional agencies. We also are fortunate enough to have a lot of community advisory committee members. So we have volunteers that go into the facilities. They do visits quarterly or more often if they can, just to kind of get a gist of what's going on in the building. And I'll try not to detour too much about COVID, but I will say our world changed a lot over the past 3 years with COVID. And we were just mentioning actually that March 14th, I think, was the day in 2020 that we heard we couldn't go into buildings anymore. I think it was right about this day. So 3 years, aren't you lucky to hear from us today, right? So how timely. So the community advisory committee members were also with us were not allowed to go into the facilities when they were first trying to figure out the pandemic and what was going on. As paid regional ombudsman, we were allowed back in long-term care facilities within a couple months, which was unheard of. I've never not been allowed to go into a facility. We did a lot on Zoom, a lot on phone. So we gained access back in, and very cautionary access. Of course, things look different in facilities now with testing, and we were doing temperatures and masking and safety measures. We only were able to gain access, and our volunteers were only able to gain access back into doing those visits back in July of 2022. So they were out of the buildings for almost 2.5 years. So we're building that back up. In the meantime, I will say that we had our particular region had over 220 volunteers at one point for all 9 counties, and we're down to about 68. We lost a lot of volunteers over COVID for many different reasons. So just throwing that out there, it's something that we do, but are definitely trying to build back up that program for sure. And those advisory committees are appointed by the local boards of county commissioners. So it's a partnership where we do some training and technical assistance, but they are appointed by the county commissioners. And so in your county, you must live in that county to represent as being a CAC in that community. So here's our first, yes, Wizard of Oz. Everyone loves Wizard of Oz, right? At least I do. So that's why it's there. There's no place like home. People, for the most part, want to stay home. If possible, if it's safe, if that's an option, yes. Some people's homes are not set up. Some people have 2-story houses and they don't have a bedroom on the first floor. Sometimes they don't have access. The bathroom is not set up, the equipment, or there needs to be modifications to your home. If those things can be done, people want to stay there. If they have a support system of family or friends, neighbors, things that make it so that they can get what they need, that's where people want to be. But there are times when people choose to move into a different setting or choose to live in a different setting. And then there are times where people, because of an incident or an accident or something happens and it's an unplanned medical issue, that people have to make other choices. So that's kind of what we're going to talk about. So the long-term care continuum, I love this slide actually. It's aging is a process. It starts at birth and ends at death. And we all go through it. It's something we can't change. So hopefully you won't think it's too morbid that we put a cemetery in there, but it's to highlight the issue that anything at any age can happen to any of us, and aging is that process. It's always interesting to me when we go to healthcare, health fairs, and people will look at us and say, I don't need to come to the table. You do aging services and I'm not there yet. And you want to look at people and go, everyone's there constantly. And it's good to be informed. It's good to know. It's good to know what your parents want, what your siblings want. Anything can change at any time. So that's kind of why we highlight that. Okay, so let's start with some of the basics. The things that we talk to when I talk about doing that before conversation. What do you need? And how are you going to pay for it? So that conversation is always, if I'm moving mom down here from Michigan, well, where is mom now? Is she at home? Is she in a independent living? Is she in an apartment? Is she in a facility? So do we need to get her down here to look at that similar environment? Medically, what does she need? Emotionally, socially, and then of course, financially. Is she going to pay out of pocket? Is she selling a home and has some private pay resources? Does she have long-term care insurance? Is she on Medicare? Is there an issue with payment? Do we need to look at what the payment options might be here in North Carolina? Is it Medicaid, applying for Medicaid, or any kind of special financial, so to speak, assistance program that might help you pay for the care that you might need? And what are those resources looking like? And how do we navigate that system? So that's just one of the big first pieces that families need to consider, or people need to consider when they're moving. So just a quick overview of Medicare. Most folks are, of course, are familiar with Medicare. A lot of times people get confused. There's a lot of good programs out there that talk about different types of Medicare, the difference with the Part A and the Part B or D, and the difference with the Advantage plans. So a lot of times when you're looking at being at home, the things that you might need if you're relatively healthy may be one thing. And so sometimes people take advantage of the Advantage plans because they're healthy. They only have a couple medications, and it might be something where the premium is very low and it gives them a lot of flexibility. I will say when things happen where you're more chronically ill or you have issues down the road, original Medicare is kind of the way to go, especially when you're looking at nursing home or long-term care or hospitalizations. If that becomes something in your life that's an issue, Medicare does pay pretty well. And we're going to talk more about those expenses and how they're covered in our different settings of care. So we'll talk about what's accepted maybe potentially in assisted living or a nursing home as well. And of course, people are familiar with that Part D pharmacy plan where you really have to look at that every year. Things change, right? Every time we have open enrollment, the plans change. We need to be very conscious of that. And we have wonderful people in our community who do SHIP counseling, and SHIP of North Carolina is very helpful in trying to figure out what that best plan might be for people. So that's just a good reminder to look at all of that and weigh those options. Every individual has some of those different needs. So what's going to make a difference for them? So the other type of a public benefit that we'll get into a little bit is Medicaid and what that looks like and what that's going to be covered in some of the buildings and the options for the facilities that we have. You must apply for Medicaid. In the counties handle it a little bit differently. You can do some information online. A lot of times people make an appointment and go in person, or they go in person with their information to see what they would qualify for. For the most part, it's really, it's not a difficult process, but it might be lengthy. So sometimes they'll say it takes maybe 45 days, maybe more to get qualified once you apply. That's if you have all of your paperwork in line, if you have all of your bank statements, things that you'll need to do that conversion. They might potentially qualify you at Department of Social Services for Medicaid and their Medicaid division. Or they may say you don't qualify yet, you have to spend down, you have to do this first, or it's pending. So working with that Medicaid office is really important. There's a lot of good resources online. But nothing beats, I think, going in person and talking to someone and getting that set up. People, oh, go right ahead. So yeah, it's not the same in every county. I just want to make sure people knew that the way that process works. So I always hate to say it, but there's 100 counties in North Carolina. There's 100 Department of Social Services, and all of them handle it very much similarly, but a little bit different. So knowing that county and knowing what you need in that county is really important. So starting with those basics, independent living, community-based support, that is the option where you might have an apartment setting or a setting where it's an over 50 community. They could be the nice little patio homes. It could be actually an apartment setting. You can actually bring home health services into that community-based support setting if you need some services, whether it's your home or whether it is a home that looks like an apartment or something along those lines. The piece that we're going to talk to you about differently is the facility-based options that Lindsay and I work with all the time and go into. Adult care homes, which also are called assisted livings. We want to make sure we use those terms interchangeably. I think Lindsay and I like assisted living better. It's more general and people understand it. Nursing homes, nursing facilities, facility-based care, and then retirement homes. So that's CCRC, which is a continuing care retirement community. And those are some of those homes that you see that have all that gamut of services, independent living or housing, houses, through assisted living, through nursing home. And then of course that highest level of care, which is your acute care settings. So you might have an acute care rehab or the hospital. Okay, so community-based services, like I said, the AAA gets involved in a lot of these community-based services, either through monitoring or promoting these programs. So to keep yourself able to be at home as long as possible, have I accessed those programs that might assist me in staying independent? Nutrition services. Do we have home delivered meals? Do we have friendship trays in Mecklenburg County here? Do we have Meals on Wheels programs in all of our counties? Can I get that healthy meal? Do we have a senior center site that might actually have a nutrition program to keep me independent and getting a good meal every day? What does the transportation look like in my community? Are there in-home aid programs I might qualify for to get me that little bit of help I might need? I'm mostly independent in a lot of ways, but I need a little extra. We have a lot of opportunity for some of our health and wellness classes that we promote. The counties have, a lot of folks have been through train the trainer programs, but our HPDP, our health promotion, disease prevention programs will teach you some of those ways to stay healthy for as long as possible. Are there options for adult day or adult day health? Where I live with my family member and they work all day, but I need somewhere to go during the day. Is that an option for me? Parks and Rec, of course, to do programs that keep us healthy. Legal services is out there to maybe answer some of those legal questions that we have in our counties. And don't ever underestimate some of the churches and the different programs that they have at faith communities where they do a lot to focus on older adults, different programming, different community groups, different dinners, and getting to be involved in that is a huge support for that person. So some of the other pieces that you might look at in community-based services, family caregiver support program is a huge one. Our office, of course, has that regional program, and then each county has a caregiver support program as well. If you have questions about it, call our office and we can get you to the right folks in your county, or there may be things that we can handle at our level as well. And then, of course, last but not least, the community-based services related to home health. Home health agencies that are skilled in their service, home health agencies that are considered that non-medical, where they may do things like chores and laundry and preparing meals and bringing you to doctor's appointments. So there's a whole gamut of services. Again, you just really need to look at what do I need and then try to tailor that service so that you don't overpay, but that you get what you need to keep it safe. Okay, I think this is where Lindsay starts. Is this right, Lindsay?
Yeah. So you get me for a couple of slides, then I'm going to pass it back over to Hillary. So let's talk about independent living. Hillary kind of touched on that. These are, this is living in your own home. But what does home look like, right? Home could look different for a lot of folks. These are folks who could be living in an apartment for older or disabled adults. Some folks live in a pay-by-week hotel or motel. I know here in Mecklenburg County, housing is not cheap. There's not a lot affordable around here. And so this is a great way for some folks to be able to afford housing. And be able to live within their budget. So this is an option for older adults. That tiny house concept, this had a lot of momentum a couple years ago. I do know folks who have built on tiny little houses in their backyard for their in-laws. So that's an option, an in-law suite maybe for folks who wanted to live with their family. We have a lot of like independent living apartments that are popping up around the Charlotte area. And I would say in a lot of the more metro areas in North Carolina, we're seeing these pop up a lot more. The next question for these is how much does this stuff cost, right? So private pay is mainly the option for this type of living, especially for those apartment complexes that are popping up. For income-based options, there are apartments for older adults and seniors that are income-based. I do know that the wait list is a long time, speaking specifically here in Charlotte, but across the state that affordable housing is a concern. So those services, home health, using that home health agency, as Hillary mentioned, for chore services or for needing help with bathing or dressing or some, hands-on care in the home. A lot of folks can utilize that. It may be more cost effective to bring folks in when someone needs that help as opposed to moving them to another location. And PACE and adult day services. So, you have like an adult daycare. We have lots of different options of those in multiple counties. The PACE program, we're going to touch on a little bit. The PACE program is a all-inclusive program that is for typically Medicaid recipients. They do take a private pay option, we understand, but that is an all-inclusive program for seniors. So everything is taken care of, doctor's appointments, therapies, everything at that PACE center. The challenge with PACE is they're not in all counties. So they serve county clusters. For example, the PACE that we work with here in Charlotte may cover more rural counties. That may be a long drive for folks if they're living out in a more rural area to be able to come to that PACE location. That's an always growing program. And hopefully at some point that those services will be more easily accessible to some folks in more rural counties. All right, let's move on to the next. All right, those continuing care retirement communities, CCRCs, right? So the life care contract places. So we have these all over the state. I have quite a few that I cover here in Mecklenburg County. They provide a continuum of care that includes housing services and healthcare. Typically, there's a large entry fee. We do have some that are coming along where the entry fee is not that large. Typically what happens is, you're younger, right? You're younger, you're in your 70s and you say, you know what, I really want to go to a retirement community. I pay a down payment, right? That down payment can look like just a down payment to the facility where I don't get a lot of money back. There are multiple contracts that people can sign that say, if I put this much down and if I want to move, I might get 20% back, whatever the case may be. And each facility is a little bit different. Okay. Most of the time, that large entry fee, you're moving in, you're there, right? Like you have committed that that's where you're going to be for the rest of your life. A lot of folks will be able to use that down payment they pay by, selling their home to be able to afford that. And then after that, there is monthly service fees past that. But that down payment and that contract show that you were there for the continuum of care. So they have all levels of care, independent living. And as Hillary mentioned, that may be apartments. And I'm going to say, guys, in some facilities we have very grand apartments, 2 and 3 bedrooms, very large, very luxurious. That can be as small as a studio. We do still have some that have studios or 1 bedrooms for folks. That could be a cottage. Maybe you like to work in flowers and you really don't want to be that close to many people and want to do your own thing. That the apartment may not be for you. A cottage or a home may be more likely what you would look at. That next level is they have assisted livings on campus. Some of those assisted livings in facilities, CCRCs, could also have like a memory care option, depending. Not all of them have that, but assisted living, and they also have skilled nursing care on site. Okay. So this is the only type of facility that can promise. So when you hear folks, kind of a buyer beware, and we'll get to this, is when a facility may say, oh, you can stay here until you die. These are the only types of facilities that can really promise that for a consumer, because the full continuum of care can be found on their campus. All right. If an assisted living, a standalone assisted living promises that, it could happen, but it could also mean that your loved one may have to go to a nursing home for a short period of time for rehab, or their level of care may become so great that they do need to move off campus. Again, CCRCs are the only ones that can promise that full continuum of care. They also have an additional oversight. So they are regulated by the North Carolina Department of Insurance. Okay. And they don't, without getting too much into the weeds of bed counts and how nursing homes buy their beds from the state, they don't really affect the population as much. So some of the newer growth that we've had in our area have been CCRCs that have popped up in Mecklenburg County in the past couple of years. All right, so let's talk about this term, assisted living or adult care home. As Hillary mentioned, I feel like adult care home, which is what they are called in our state statute, that can be very confusing to some folks. I think a lot of folks hear adult care home and they think like a group home for the disabled, developmentally disabled. And that's not what an adult care home is. It's an assisted living. It's just an older term that we use. So I'm just going to refer to them as assisted livings because I think that's a more general term that most people understand. So we have a lot of assisted livings in North Carolina, right? And they provide those custodial needs, right? So dressing, bathing, toileting, medication reminders, nutrition assistance, and some intermittent nursing care needs. All right. So blood pressure checks, weights, medication management, behavioral supervision. I will tell you that our assisted livings over time have kind of grown to let people age in place more than they ever have before. So sometimes when you walk into an assisted living, you may expect to see just an older adult, maybe with their walker, walking down the hallway, getting their meds and having their meals prepared for them. Maybe they just need standby assistance with showering. we see a lot more medically complex people in assisted living now than we ever have before. People have kind of been allowed to age in place, and those needs are sometimes complex in assisted living. It's just kind of like the way the industry has worked for the past couple of years. And you will see some facilities, if you were to walk into some of my assisted livings, you would say, is this a nursing home? There are some pretty frail looking folks who live in here. So that has changed over the years, but typically, folks, this is what assisted living should provide and should always provide for individuals. Okay, so let's talk about another little level care of adult care homes in the state of North Carolina is a family care home, right? And this kind of breaks down what that looks like. A family care home are typically facilities that are in houses. So we have a lot in the area I cover. These are popping up all over the state. I know our coworker up in the Raleigh area has a lot of these in Wake County. So they are 6 or less residents that live in a home. Okay, and they can't be related to each other. They are licensed by the Division of Health Service Regulations. So they are technically adult care homes, but they cannot serve more than 6 people. Okay, in assisted living, same rules and regulations. They're licensed by the Division of Health Service Regulation, but they have more than 6 people. So I think my largest facility may have like 129 beds. So anywhere from 7 beds to 129 beds. I think my smallest assisted living closed a couple of years ago was around 10 beds. Most are around 50, 60, or 70. Some of our older facilities have a lot of beds, 120, 125, 130 beds. Facilities can restrict by age. So they can say, assisted livings can say, you know, we're only going to serve people who are over the age of 60. I have some facilities, assisted livings, that cater towards a younger population. You may find some older adults in there, but you may also find some younger adults with some mental health diagnoses, who have a lot of needs that require them to be in assisted living. These are all found right there on that website right there, ncdhhs.gov, for the star rating system. This is something that we'll point consumers to when they call and, you know, are overwhelmed and mom needs to go someplace. I don't know where to start. I typically tell folks, look at this information. This is where you can find the most recent surveys by the state survey agency in assisted livings for those family care homes and the bigger assisted livings. Be kind of little buyer beware on that, though. I would never choose a facility based only on the star rating system. There's a lot that goes into making those stars, and it depends on what the facility is written up for, depending on their star rating. So I have a good example of this. I have a facility that I don't ever really get complaints in. I'm sure they have the complaints, but I don't hear about them. So they take care of their concerns, which is what we want facilities to do. They're an older facility, so sometimes they'll get a write-up for a light bulb being burned out in the exit sign. Is that important? Absolutely. But then I can have another facility that forgot to give someone their insulin for 5 days, but their score could look similar. So that's where I'm like, please read what's going on in those facilities, because they're both very important things. One could be more detrimental to a resident more than the other. And it's very important to read through those. I always tell folks, if you have trouble sleeping at night, that's a great way to go to bed, is by reading those reports, because they are long and lengthy, but they do share a lot of information. All right, those services, those basic medical monitoring, 24-hour supervision and security, meals, housekeeping, laundry, transportation, and social programs. Remember, in assisted living, now these are not federal, there's no federal oversight for assisted living. So we're speaking specifically about North Carolina facilities. There is no requirement for licensed professional staff. Okay, so you may see some physical therapists in there. You may see some nurses. Those physical therapists may be from an outside agency that are coming in and providing services. You may see more nurses, maybe from a Bayada or something, coming in to do wound care. They do not work for the facility typically. So some facilities do have a nurse on staff. That's great. It's not required, other than a nurse to come off and check off on care plans and to do tasks. So if you see a nurse, the challenge is that's great, but it's not required. So if someone were to take a vacation or they had some turnover in staff, the facility may not have a nurse on duty for whatever time period. So just know that that is not a requirement. like it would be in a nursing home, which is what Hillary's going to talk about. All right. And then the last one on adult care homes, payment. How are we going to pay for all this? Whoo, guys. All right. So payment and room and board. All right. So let's talk about what that means. Private pay. You pay for your own. Long-term care insurance. If you could afford those premiums for years, that's great. That, you know, we can use that insurance to pay for that monthly service fee or help offset the cost. Veterans Aid and Attendance. That's a program that veterans can sign up for. It does take some time to qualify for that program. So we always tell folks, make sure you're starting early. State County Special Assistance. So State County Special Assistance is a Medicaid type program for assisted livings. We have that in the state of North Carolina. The challenge is we have very few facilities that accept it as payment. I just lost another facility last week that will no longer be accepting State County Special Assistance as a form of payment. The reimbursement's not great for the facilities. It's a lot of extra paperwork. A lot of facilities have just decided to opt out as it is not required. So this is causing a challenge for placement for a lot of older adults that are living mainly on their Social Security for assisted living. So that private pay level. So private pay is usually, you know, you got a room and board base of some sort that may be like, I don't know, $2,800. That includes your meals, your housekeeping services, and all that good stuff. But when you're needing care, those are usually additional payments, right? So they could do it by a level of care. Each care task has a point system attached to it. So Hillary needs her TED hose put on. That's 4 points, right? Hillary also needs a special diet. That could be 3 points, whatever the case may be. I'm just pulling this out of my head. All those points are added up and you fall into a range, a level 1, level 2. Each level has a dollar amount attached to it. All right. And that this is not regulated. The facility, when you sign that contract, could say this is what you're going to pay. It could also be like a la carte. That's what I call it. I don't think the facilities call it that, but I think it's the best way to explain it, is that each thing that the facility does for you has a dollar amount for it. So it's like going to a restaurant and ordering a whole bunch of appetizers for your table, and then you're just charged for each individual thing. So the price ranges, y'all look at that number, $4,000 to $12,000 a month. It's a lot of money. And I don't think people realize how expensive long-term care is. Especially when you don't have a lot of options, maybe for that Medicaid State County Special Assistance option. So just let that number sink in. So then Hillary's going to talk about nursing homes. Take it away, Hill.
All righty. So the skilled nursing facility, or nursing homes, as we usually refer to them, they are your highest level of care beyond that maybe potential hospital stay or an acute care setting stay. The biggest thing to know, a lot of times, of course, you're in the hospital, something has occurred. I've had a fall, I've had a knee replacement, a hip replacement. I'm not able to go home. And a lot of times people do get confused because years ago, a lot of the hospitals would keep people and do the rehab in the hospital. Sometimes you can get rehab in the hospital depending on what's occurred, or you might get rehab in that hospital type setting, that high level of rehab, which usually is 6 to 8 hours of rehab a day. A lot of people don't get that when they're older adults. Some do, but it's not as common. So provided the nursing homes have now stepped up over the last 10 or more years and done most of that short-term rehab. So you're going to a skilled nursing center, that is that rehab center. The difference is that they do have 24-hour licensed staff. It may be RNs, it may be LPNs, it may be a mix. You do have more of that professional staff requirement, like Lindsay mentioned in assisted living. They might have it, but they're not required to. Nursing homes are required to have that. You also have those services set aside for rehabilitation where you're getting speech therapy, occupational or physical therapy. Nursing homes have more of a guideline when it comes to how they're regulated. So because they're federally regulated, every state is very similar for what a nursing home can provide. And again, comparing it back to what Lindsay mentioned about assisted living, is it's state regulated. So each state may look a little different. We do tell folks to go and kind of look at that Medicare.gov compare site, which is actually a pretty good, robust site, which has basic information on how that facility did, if they've had some deficiencies, if they've had recent surveys and what they've said, if they've had complaints, and you can pull up a couple and compare them to each other in the county. It is just a starting point. It never actually is something where it circumvents going and visiting, going and calling, seeing what's available. A lot of times the hard part for families and for people choosing is that you've had some kind of injury or issue that's occurred. And then within 3 days, hospitals don't keep you very long anymore. And you're making this choice, and it's a big choice. And the case management at the hospital is going to come up to you and say, okay, here we are. And you've got 35 nursing homes to look at, but these 3 have made what they call a bed offer. So you're trying to scramble. So gathering as much information as you can. A lot of times people do reach out to us and ask what we know, and we can tell them factual information about the facility, and try to get the best choice for you, and just give you some of that information. I think there's another slide or two on skilled nursing. So the basic services that they offer, if you are there beyond your rehab stay, everything that she mentioned in assisted living. So all of the help with your activities of daily living and bathing and dressing. They do have that 24-hour licensed staff. They do have that rehab. But one other thing I always love to tell people is that they do have social workers on site, which assisted livings don't have, usually 1 or 2. Some work with the people that are there long-term, some do some rehab. And unlike assisted livings, skilled nursing facilities, again, because they're federally regulated, will serve anyone 18 and older. So I always think it's interesting because people might, older adults live in skilled nursing facilities. It is true, but there's an amazing amount of people who are 30, 40, and 50 years old in nursing and skilled nursing. If you haven't been to a nursing facility in a while, it's because people have accidents and injuries at all ages. They might have lived alone, they may not be married, or their family's out of town. And you have people who have had strokes at young age or early onset dementia, things like that have caused them to need the services in a skilled nursing facility. So that's something that people sometimes are alarmed about. Like I said, I worked with an individual who's 33 years old, and he's lived in facilities for almost 17 years. It's amazing to work with people like that, just because of an injury he had in high school. So you just have a very different feel about what those skilled nursing facilities can provide, and it makes a big difference. I think there's another one. So yeah, we'll talk about how those skilled nursing facilities are paid. So when you're coming out of the hospital, of course, you can get that Medicare coverage. And the misnomer is that most people hear Medicare covers 100 days. Medicare can cover up to 100 days. It covers, this is your Medicare A plan that we talked about. The Advantage plans are all different, depends on your Advantage plan, but straight Medicare A, traditional Medicare, they're going to cover 20 days. And then at 21, they're going to cover 80%. And that just depends on if you're qualifying and maybe you've rehabbed really quickly and you don't use all 20 days. Maybe your rehab is taking longer and you might get 60 days. So it really does depend individually on that person, their progress, their goals, and how they're doing with that rehab and what kind of rehab they need. So sometimes you'll see people staying in the facility for up to a couple months, potentially on a Medicare, plus some private pay. So of course, nursing homes take private pay dollars. I would say not as many as there used to be, because everybody's spending their private pay dollars in assisted living, right? Nobody's taking any kind of special assistance in assisted livings anymore. And it's getting harder for Lindsay all the time. That's something that she gets constant calls about. So nursing homes do take private pay. They love private pay, but not many of them have them. They might take long-term care insurance. Of course, they do that. They may take veterans benefits. They may take straight Medicaid. And a lot of facilities do have their long-term population has a portion of Medicaid. What happens sometimes that people don't realize when you're applying for that Medicaid is that it is a third-party payer. So that means once you've exhausted your Medicare coverage, Once you've decided I need to stay here long-term and I need Medicaid, you're still going to have to give them your Social Security income or your pension, and then Medicaid picks up that difference. And the residents that live there on Medicaid only get a certain amount of what they call a personal needs money every month, and that makes a big difference. Sometimes people don't realize that that is how it works, but that is that process. And they don't get much in the pocket, but everything is technically covered at that point. So we talked about your Medicare. The price ranges, kind of like Lindsay mentioned, are very similar to assisted livings now in the world. They used to be more, but it's ironically similar, but you will usually have a per day rate. So you might only need to stay an extra week and you're willing to pay that per day rate before you go home to make sure it's safe, or you're getting some kind of excuse me, modification in a bathroom or in your home. But those ranges are between $8,000 and $15,000 a month. So that's quite a bit of money privately that most people don't have. Or if you do have it, you're going to spend through it quite quickly. And that makes a difference as well. So I think Lindsay's going to jump onto special care units and talk a little bit about that.
Yeah, so another level of care that can kind of be found in what we've talked about in those assisted livings or nursing homes is called a special care unit. So again, this is kind of a state term for a memory care unit. All right, so a lot of facilities will say our memory care unit or our memory care support or whatever the case may be, different marketing terms, but they are licensed special care units. All right. Typically kind of across the state, these are found more in assisted livings these days than they are in nursing homes. We do have them in nursing homes. For example, all the facilities we have in Mecklenburg County, Hillary only has 2 nursing homes with a memory care unit, a special care unit, which doesn't seem like a lot. And I think this is because, how we were talking about how the levels of care have kind of progressed over the years, that people are aging in place more in assisted living. The need is more in assisted living than it has been in skilled. So these units are, the resident has to have dementia in their diagnoses, right, to be living in these facilities. So you can't put someone into a facility, and that's something you should also know. No resident is ever told they have to move to a facility and made to stay there against their will. But in a memory care unit, these are folks that have to have dementia, right? They can't be living in this unit without that dementia diagnosis. Most of the folks in these, they require a locked unit. All right. So they could be wandering. They may be exit seeking, hey, I don't want to be here. I'm going to go home, but they couldn't tell you where home was. And they also could not figure out, they don't have a lot of safety awareness. So they would not know to not walk out into the street or to get in the car with someone who they did not know. So these units, if it is truly a licensed special care unit, and I'll get into that in a minute, these have increased staffing. So more staff per resident. They have to have additional programming for those residents, and the staff have to be trained more in dementia care than just a traditional assisted living or a nursing home. Buyer beware on this, though. We do have some facilities that have locked units, meaning they took a hallway and put a locked door on it, but they are not licensed special care units. Okay. So they are not, the resident would not be benefiting from any of those things like increased staffing or more education or more specialized programs. And this has become a buyer beware situation. We do have quite a few facilities that have done that. And that's something an ombudsman can very much help you with during a search of, yes, they have this, but buyer beware asterisk, this is not really a licensed special care unit. In Hillary's world, in nursing home, there are some, they look very similar. They just have a person living in that unit that has more complex medical needs. And that's the reason they're in that skilled nursing facility. My clicker doesn't want to click. There we go. All right, buyer beware. So you're looking, mom needs to go to a facility. You have a loved one that needs to go someplace. We always give some folks some buyer bewares. All right. So always pay attention to what you're doing when you're looking in long-term care. All right. It's very easy to believe what you're told. And we want folks to question things. What did my old professor in college always used to say? Question authority. Now, you always want to make sure that you're looking past what you're given, right? So you're checking the regulatory sources online. We gave you both of those for nursing home and assisted livings. That can help you a good bit have a better understanding of what is going on in that facility regulatory wise. If you call the ombudsman program, they can help you find that. They can help you even go through some of those findings. Nothing beats an in-person visit to the facility, though. I'm going to be real honest. When you go into a facility, you know, you're using your senses. I'm going to skip down a little bit. You're using those senses when you're walking in. Does it smell? Sometimes smells happen in a facility. They really do. At certain times of the day, that's okay. Does the facility constantly smell though? That's not okay. All right. So if the trash was just taken out, totally understandable. Shift change, just change. Okay, that can happen. But if it is a cleanliness smell, as in, you know, no one's mopped that floor in quite a while, that's a problem. And that's a problem for residents. A facility should not smell all the time. Using your eyes, are the residents engaged? Are they sitting there? Have they all been parked in front of the nurse's desk staring at each other? That's a problem. Are the staff interacting with the residents? Are they talking? Are they having a conversation? Or are they just walking by and not paying one bit of attention to those residents that are around them? That's a challenge. Looking at those activity boards. This is my favorite game to play when I go to a facility and I look at the activity and I'm like, oh, look, there's going to be music in the sunroom. And I go down and there's nothing going on in the sunroom. Red flag. Hey, why do we have this on the activity board if we're not actually having that activity? All right. Looking beyond those marketing materials that are given to you. If you look at the marketing materials, of course, the facility is great. It's beautiful. It's new. We have excellent staff that take care of you. Look past that. Look to see what's going on in that facility. There are some culture change efforts going on in the nursing home world. Hillary can talk to you way more about this if you ever did want to talk about this, but nursing homes can opt into a grant program where they actually can use some civil money penalty funds. So when a nursing home has a write-up from the state, they say, you know, you did not meet this, we're going to give you a fine of $10,000, whatever the case may be. That money goes into a fund. So as a way to put that money back into facilities can apply for grants that improve the quality of life of the residents. So maybe they say, you know what, we have some folks who really would just like a chill kind of hangout room that allows them to, you know, get away from all the extra stimulus in the facility, you know, maybe a memory care unit. We'd like to be able to make this room work for the resident. We'd like to put in raised flower beds so the residents can have an activity outside, whatever the case may be. So that's something cool that goes on. That's only for nursing homes though. Assisted livings can't qualify for that. Let's get back to the facilities. I'm sorry, I jumped around a little bit. So when you're in that facility and you're talking to folks, also talk to your residents and your families. You'd be surprised what the residents will tell you. I love to talk to residents just randomly in the hallway because they will tell you 100% everything that's going on in that facility. And you know which ones I'm talking about, the folks that hang out at the desk who know everything that's going on in that facility. And it's also good to talk to their family members. You know, if they've had concerns as the staff, you know, working with the residents, have you gotten resolutions on your concerns from the administrator down? Families typically will share their experiences. Okay. Get a copy of the contract or admission agreement to review ahead of signing. Please, 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 guys, when you move your loved one into a facility, if you have not done your homework ahead of time, this is an extremely overwhelming situation. It's overwhelming even with the best planning. It gets very, very overwhelming when they start shoving papers in front of you. I don't know if anyone's ever signed a lease or bought a house where they just throw things at you and you're signing. It's very similar to that. People don't realize what they're signing. All right. Especially in assisted living world, for those levels of care, you may not know if you're private pay, how much you're agreeing to pay, if the level of care increases. In a nursing home, you may not know if you've signed an arbitration clause, waiving your rights to certain legal aspects. There are things that you do need to get a copy of that before you sign it. Reviewing your pharmacy plan every year during open enrollment, even if you don't make changes, it's always good to review it. If you've had med changes or a plan change, it's always good, no matter what you're doing, to have a SHIP counselor at a local, maybe senior center, help you with that. Don't take a verbal agreement for special rates or deals. All right. Always have a signed copy of all materials from the facility. All right. Great example. I had someone call me the other day whose mom had moved into an assisted living. Mom had maybe 10 months of private pay dollars to spend. The facility promised that they would let her spend down to state county special assistance. They took a verbal agreement. There was nothing in writing. New management came in, absolutely did not honor that. They had nothing in writing, and that woman spent all of her money in the facility, and now is going to have to move to a facility that takes state county special assistance, as the facility will not honor it. All right, so get everything in writing. Things can happen quickly. I touched on arbitration clauses. That happens in both assisted livings and nursing homes. Nursing homes have a little bit more protection that, you know, residents or families, when they're signing those contracts and those agreements, when they move into facilities, that sometimes they are waiving their rights to a jury trial. If things were to happen, it forces you into arbitration. It's a very legal thing, but there's lots of information on it online, and we can help you get more information about those forced arbitration clauses. A lot of folks will sign those contracts, you know, especially DSS employees and guardians we talk to all the time, where they sign those contracts, they circle that area and say, absolutely, I will not agree to this. So that's an option for folks as well. Nothing beats an alert, competent person. All right. So all services and supports are driven by the individual's decision making, right? We want to know what that individual wants, right? So we want to talk to that person. If that's not possible, if advanced directives such as a power of attorney can assist if the person is unwilling or unable to make decisions on their own, or they can't, family decisions may not be in line with what the resident wants. I know that you've got some people on this call that have been in the middle of many family drama dealing with a loved one. It happens everywhere. All right. It is very challenging. It's very high emotion, high risk situation when someone is sick in someone's family. If you did get along before, sometimes people don't get along when mom gets sick or whatever the case may be. It's a highly emotional time. People don't always make great decisions. So it's great when you have a resident who can explain what they want, a person who can explain what they want, if not to have that well documented in an advanced directive of some sort. Planning ahead is crucial to success. Don't make decisions in a crisis. All right. It's very hard. Even we say all the time, we know what we're doing. We do this every day. I've been put in situations where I was so stressed out that I'm not sure I made the right decisions sometimes. So for anyone looking to place a loved one into a facility, please plan ahead as much as possible. All right, so this is kind of like that circle of everything that an older adult can move into. So you've got your home, your hospital, your doctor's office, your rehab center, your nursing home, your specialist. There's a lot, right? Who's in charge of all that? You are. Unfortunately, there's not really a service that tracks all of that. So if you're caring for a loved one in the home, it's overwhelming to say the least, that all that information you're kind of keeping track of. In a perfect world, all your doctors are in one health system and everything's on your online chart. That doesn't always happen. And if someone goes into a facility, having that paperwork from what happened before is necessary, having that power of attorney paperwork. My mom used to joke that she just walked around with like a 3-ring binder when my dad was sick for years. And she was just like, here's everything you need to every place that she went to make sure that that was documented. All right, so we have a couple options here for learning more. So these are all great websites that we pull information from. You've got Medicare.gov, you've got the state website, Division of Health and Human Services, the National Association of Area Agencies on Aging, some, consumer voice is something I'm going to highlight. That's something that Hillary's actually been on the leadership team for a couple of years, but that is our kind of federal advocacy group for long-term care settings and getting good care for the residents who live in those settings. So those are great resources. Questions. All right, Kristen, I'm going to throw this over to you. And I think there are some questions here.
I actually pulled up some I'm jumping over Kristen because she loves me so much. I handled a couple questions that were coming up. We had a lot of really good ones actually, but there was a couple that I thought would be really interesting to answer for the group. And we can run over time just for a couple minutes if we need to, but if you have to go, we understand. The first one, and I think Lindsay might like to tackle this because it comes up a lot. The retirement home, so the CCRCs that this person looked at did not accept Medicare or Medicaid for its nursing home, but without that certification, the basic resource for checking the quality of care with comparable data is missing. So if one wants to be prudent and prepare for the most intensive level of care, how do we check for the quality of those types of facilities? And I know you like this question, Lindsay.
Yeah, that's funny. I have two that are like this. Oh, three. I have three now that are like this, that are completely private pay, CCRCs. They do not have any certified Medicare beds. I've actually directed people to the Department of Insurance before to find out more information on their website. It can give you a little bit of information. It's not going to give you any regulatory findings. I've actually referred folks to surveyors before. So because it's not available anywhere online, it is still public record. It's just there's no place for it to go on any website, I guess is the best way to answer that. That I have found the most recent surveys for folks in those facilities, but I had to kind of go through our regulatory agency to get that information for them. So it is there. It's just not easily found. And again, that's such a weird subgroup of facilities that we don't have too many of those. As I said, I have 3 in Mecklenburg County, and I think those may be the only ones in our whole region that are like that. And there are only, Valley Hillary, correct me if I'm wrong, I think there are only 12 like in the whole state, 12 or 15 that just run on those state guidelines, no federal oversight for the nursing homes.
Exactly.
Yeah.
One other person asked, and there's 2 more that I'll probably put in here.
Okay.
If time permits, can you talk a little bit about how you navigate those hard conversations with families and when they do not have funds to pay privately and they're not eligible for Medicaid, state, county special assistance? Families often ask, what do I do? And so I'll just take a quick stab, but it is a huge, hard conversation. It's hard to have the conversation that you can't live at home and you need to live in a facility permanently, let alone when you have very limited options about what you can afford. And so instead of saying I have 50 choices, I have 3, or I have to leave this county because I can only go to Stanley County with what I can do, or that's the only place for me. And it is a hugely difficult conversation, trying to pull in family, talking ahead, pulling in the doctor if you need to, whoever that person might listen to better. But I think just being prepared and thinking about how to have that conversation. I don't know if you have any other suggestions, Lindsay.
Yeah, I mean, when you have that person that's really hard to place, unfortunately, that I tell people all the time, it's so I sound so tacky on phone calls anymore, where people are like, hey, you know, I have a loved one, they don't have a lot of money, and I'm going to be like, what can they afford? Because I'm not going to tell you to go to a facility that costs $8,000 a month. They may actually have to go to Anson County to find something affordable, or Stanley County, a much more rural place. Yeah. And I don't, you know, the answer is sometimes we don't have good answers. And it is pulling in, as Hillary said, pulling in that doctor. We have worked with folks who sometimes have had to be placed in nursing homes, maybe a little too soon. But they have like a little diagnosis that will get them into that long-term care nursing home setting with the correct FL2, which is really, really challenging, and it shouldn't be that way. But this is becoming this challenge of finding affordable long-term care and assisted living is really becoming a daily battle for us and for a lot of other folks.
And one of the other questions that I thought was a really good one, there were so many good ones that I answered in the chat or tried to, just because of time. But one actually mentioned, do you all see any transformation coming to North Carolina as far as assisted living, skilled, or long-term care setting in general? It's a very dismal process, and I struggle with what my patients are left with. And I think that I would be hopeful to say yes. I think for many years we saw some transformation. I think COVID threw a real bad monkey wrench into the process and plan. Right now, the worst thing we're hearing and hit in it, I don't see it changing anytime soon, is staffing and supporting staff to make a good wage, supporting staff who want this as a career, and working in these facilities, because you're taking care of these people who need you, this frail population, this chronically ill population. And it is very dismal. You look at it and think, it looks like I have a lot of options, and I don't always, but I would love to think that there is some transformation coming. I think we were set back by COVID. I would love to think that with the Medicaid expansion, we might have some good things on the horizon, albeit it may take some time. But I don't know if you have any other thoughts, Lindsay.
No, you hit that.
it's a hard one.
Again, you know, we always say that the systems were broken before COVID. COVID just ripped the Band-Aid off, guys. And I still think that we're in that trying to figure out what's what phase. And I don't want to say post-pandemic because COVID's still here. Our people are still getting sick in facilities. But now that we have some time to not be in panic mode. That, you know, I do think that staffing is probably one of our biggest concerns right now. And it's not just frontline staff, it's administration down. I have some facilities that have had turnover from the top to bottom multiple times since the beginning of the pandemic, which is really challenging. That's next level challenging for folks.
We had a lot of good comments in there, like I said, and I'll let Kristen finish it up for us if she has any words of wisdom. I do know that we had a lot of questions about the PowerPoint being available, and I know the goal is to put it up on our website and make it available. But I'll just leave it with Kristen, and we really appreciate all of you.
Yes, thanks, guys.
I don't have much to add. I want to say thank you to both of our speakers today. Like Hillary just mentioned, the PowerPoint and recording will be uploaded to our website, so you'll have access to this, or if anyone missed it and you think that they'd gained some insight from this presentation, please send them to our website to access this later on. I will note more information about our webinar next month will be coming out soon, April 27th. It'll be all about arthritis and how to access services in terms of arthritis and evidence-based programs, etc. So keep an eye out for the flyer for that. Registration will be open soon. Other than that, that's it.
Well, awesome, everybody. We really
Thank
appreciate
you.
being here, if I can speak, but we really appreciate it all.
Thank you.